The practice of medicine, I feel, has really changed.
Access to appropriate therapies is a huge issue today.
All of this administrative burden for pre-authorizations have the highest paid folks doing administrative and clerical work, and that takes them away from delivering patient care.
I think my turning point was with the PCSK9 inhibitors. Sick patients, early heart disease, very, very high LDL levels, they were all appropriate. And lo and behold, every one of them was denied.
So my doctor prescribed it for me, but I was denied. I said, we're not stopping. We're going to keep appealing this until we get something else. Well, it went on for 2 years.
I had nobody on the medications. I didn't have time for the paperwork, and the nursing staff did not have time for the paperwork.
We're talking about sometimes 3 to 7 pages of filling out information to get the approval. And sometimes once you have filled it all out, it still comes back rejected.
You know, they said, go read the guidelines. And I said, I've already done that. They said, it doesn't matter, you need to go back and start over. Over and over and over again.
I feel, having worked in medicine for 20 years, I've got a good grasp of which patients should be getting medicines like the PCSK9s and which patients should not.
And saying yay or nay, approval or denial, that whole process is flawed.
And we get deviated from the true problems like blood pressure, cholesterol, heart failure.
It makes people feel powerless. You know there's something out there that can make a difference in your outcome, but you just can't quite get there.
And this becomes a very monotonous and really depressing situation for the provider and for the patient.
It requires fights, fight after fight after fight after fight.